Good morning, this is Dr. Bill Wyatt again, and with the American Orthodontic Society, and I wanted to talk to you a little bit this morning about surgical cases, and this is on a young lady, which might happen to you as it did to me. Now, sometimes young ladies will have a lot of male hormones and they react orthodontically similar to what males do. Not quite as bad or as much. I've had the young males, you finish them up to class 1 when they're 12, 14, 12, 15, and then when they get 20, they'll grow out from under you. They'll just come forward. So if the person has parents or somebody with a lot of class 3 problems in it, just suspect that might happen and tell them about it. If it does happen, then you've done the orthodontics up to one point, then you've got to start over again and do the surgical orthodontics. And you let them know it's not your problem, it's their problem, and they have to go through this surgical procedure if they wish to finish the case like that. Now, most young males can put up with a kind of a light class 3 problem, or they have an end-to-end relation like this. But a young female, the class 3 kind of messes her facial structure up more, and they will need to come back and do the orthodontics more than the male will. All right, let's get going on this. These were done back in 1972, I think we started it, and she has no class 3 appearance at this point right here, except she's got a lot of crowding, and the gum line and everything's good. And we went in to look at the case, and it was extremely crowded. I mean, it was really crowded. She's got large teeth, and she probably had one of the parents had bigger teeth than the other one, and maybe she's got the bone structure from one side and the tooth size from the other parent. So anyway, we've got a problem with size. Now I've got a problem with the mold. The models got moist some way or another, and this messed them up. Now we've got a crossbite on both sides, kind of indicating a mouth breathing problem, where the person would keep the tongue on the bottom part of the mouth, and I have to get here and mark this off. For if the tongue stays down in this part of the mouth, these teeth will get broader and they'll run out. Actually, the groove of the upper tooth, like if you come in like this groove ought to fit over this cuspids on the cusp on the lower arch like this. And so, correcting these, we normally expand the upper arch a lot to get the lower teeth back underneath where the upper tooth fits kind of like this, and the lower tooth will come up and fit in this groove right here, see? And this keeps you from biting the cheeks out here. Your cheek will come along and this holds it out. As this spreads out, it gets further out to this point right here, and I am this way. I bite my cheeks. I'm a mouth breather. My lower arch is too wide, and I really ought to go into orthodontics and have it done at this age. But I'm not about to do that. And so anyway, we work on, that's a regular dental problem. That's not a class 3 problem. But this is kind of headed toward class 3. And the case here, they take out the lower wisdom teeth. Or at the upper, you can see it's more narrow, and it's fitting kind of inside the lower. You see the lower's broader across here than the upper, comes in about like something like that in there. So you go in and broaden the upper arch out on this case like this. So here we go. Let's run through this pretty fast. Now we're in 1973, and we've already extracted the first bicuspids, or at least I had her dentist extract them. I stopped doing nothing but orthodontics back in 1970. And here was the case to start with. It's not too good of a set, but you can see it's not, it's kind of looking like a class 3 case to start, but not much. So here we see the place where we took the first bicuspids out all the way around the deal, and let these cuspids come back in together. And this space in here, we'll see in the next video, the next Panorex, the cuspids and first and second bis erupted and filled that space completely. It didn't change their profile or anything. Now, we put a separator in here to kind of push this tooth back to get it to come on up, and did a little bit on this side too. Now we've got wisdom teeth down here that are going to be a problem. The wisdom teeth up here, you leave these alone. They'll push on this going forward. This tooth right here will have some effect that way. You take this one out, and that relaxes this, and this helps it correct your class 3 problem, or it's kind of retention of a class 3 problem. All right, here we go. They haven't done anything with the wisdom teeth at this point, and here the case was done with bands, and that's I tell you, bands are a no-no. It's much better to do the brackets. You can't finish them just right, but we got this lined all up. We put a class, a midline elastics rig on it, and it's pulling this back. We're pulling this one over to the right, and this will be pulling over to the right, and we've got class 3 elastics pulling the whole thing back at the same time, and we're trying to line this up and bring this back in. So you can see the use of these elastics at this point. Now, coming through it, there it is, just open. You can see the rubber bands, how they work. And we've got this class 3 is showing up now, and she was going with the son of a dentist that referred patients to me, and he, in fact, she was helping him with his mathematics and everything. She had these, she's got some male hormones in her, and so anyway, she goes through all of this, and we had her finished out good, and she was looking good as far as closing the space and all that. And now we got some more mold. We've finished it up to this point, and then as she got up about, I think it was 16 or 17, he told me, this dentist called me and says, this young lady's looking bad again. Said she's getting this class 3 is developing on her. Her father, by the way, had a class 3, not seriously bad, but it was bad enough. So he wanted me to do something about it, and I had told the parents prior to this that this might happen, and so they had to go through orthodontic expanse twice in doing this case. So let's get it. So I turned her over to a surgeon friend of mine, and he used this in one of his lectures, and so he gave me the pictures to use in my lecturing. Now the vertical height of the face at one time was here, and he got it down to 67, which saved that. And then he also did a genioplasty on here. Let me get little deals fast. So here we are. Now this is after surgery. He cut the jaw down here and brought it back in, and he sectioned this off and took part of the bone structure away from the sinus, and then he advanced the chin. I think I have another picture here in just a minute. Yeah, here is what he had. He shortened this right in here and pulled it up and tied it, and he sectioned the jawbone here and maxed it over, and he could put screws in it, but whatever it was. Now this has a lot of effects on the jaw joint, so people do have problems with that. And advanced this genioplasty, had the little chin button moved forward on that, and this is what it looked like when he finished, like that. Now he took the wisdom teeth, I think the surgeon took that out, but he left this one up there to put some pressure on this, and this was gone to keep it from pressing on this too. And you see where he moved the chin forward right there, and you don't see how much he cut off of the maxilla. But when you get to the end of the case, you'll see how different it looks. Now these are the things the surgeon, he went over and saw these things that were wrong and what he wanted to correct. And he had me weld these little hooks on the case, so they wore elastics on the case, keeping it lined up like that. Those are little brass hooks you have to stick on there. And by the way, I'm a general dentist, but I've done so much orthodontics, and I had probably 6 or 8 oral surgeons that I worked with, and they knew how to do the orthodontics. That's all they cared. They didn't care whether I was a board certified orthodontics with a regular deal. I am certified with the American Orthodontic Society and the International Association of Orthodontics, but the surgeons didn't ask me anything. They knew I could do the work, and so they went on with that. And so we put that to hold the jaw together at that time. And they used to cut the models down to make sure it fit. Now this is a pretty gory picture to put in here, but he gave it to me to show how he pulled that maxilla up and put these wires in there. Now they use a little plate that'll come in, something like this, and have the screws in it and hold the bone structure in place with these little metal plates. And you've got to have some freedom in there to keep from starving the disc to death, which we did a lot of before we learned that. Now that's at the end of it, and this is where it's shortened. You can kind of see the jawbone is growing back together in here. In this part, this is a genioplasty. They move the chin out, and it's somewhere there they may have taken the wire out, holding the maxilla in place. And here the teeth, when we had finished, the case, and it's in good class 1. Now the young lady looked like this to start with. Now this, we had her when she was about 11 or 12, or maybe 13. She looked good. Then as she got older, she began to look like this, and this is when that dentist called me and told me that really I really needed to do this over again. So here's the way she finished up, and you look at it here, she's like that, and this is the final picture we've had of her, and it certainly improved that young lady's looks, and I think she went on to become an engineer going to A&M. So I hope you get something from this, but check every class 3 that parents, if the parents are class 3 at all, or anybody in the family that's class 3, and look at the patients before you start in. Now boys, I finished several young men, just had them lined up like a clock. Well, it was really good. And then as they grew older, their jaw would grow out like this. And sometimes they'd grow up to 20 and 21, 22 years old. So this is the end of this. I hope you get something out of this. There won't be too many of you do surgical orthodontics, but this is what can be done in there. And you, if you learn how to do the orthodontics real well, that's what you have to do. The surgeon, in other words, this makes correcting a class 3 case a little easier for you. You don't have to do some things that you do if you treat it non-surgically. So I'm going to say goodbye, and I hope you get something out of this, and I'll just close it out now. And thank you for looking at it. I hope you'll join our group and subscribe to it. So I'll close out now.